Yeah, hi, this is Dr. Zuckerman. Today we're going to talk about pain and inflammation and the use of the Remy laser. Indications. I always call it pain in the ass. Pain, inflammation, arthritis, or mobility. Another thing I want to talk about, which is important, is lasers are used for pain and inflammation. When I say pain and inflammation, I'm talking about plantar fasciitis, Achilles tendonitis, sprains, strains, injuries, post-surgical, anything that's inflammatory and pain or arthritis. Plantar fasciitis versus plantar fasciosis. If there's a true degeneration of the tendon or the disc, lasers are not that effective. They can heal, but if it's a true degeneration and there's no inflammatory component, the results are not going to be that good. Lasers are used as an option or substitute for injections, anti-inflammatories, long-term physical therapy. I always say patients hate needles. They hate them. This is an option for giving injections or medications. And our marketing will help you support this. Now let's talk about the actual procedure. This is the therapy head. It's very light. It's only 8 ounces. It's set for 20 millimeters. It's all about power density. All about power density. You got to get the right dosage when you're doing pain. The laser is set for 10 minutes, but that's not how you know you've determined that you're done. Now I'm going to give you a little science. It's not going to be in great detail, but I want you to remember you're done when the pain is done. And remember the word palpation, palpation, palpation. So how does it work? Light energy gets into the mitochondria, specifically the chromophore C reactor, stimulates ATPs, which you get a cascade of decreased inflammation, decreased pain, lymphatic drainage, and a whole cascade of cellular repair, etc. I have a 3-page, actually a 50-page PowerPoint that I can send you talking about the biochemistry, and I'm very happy to go over that. But this is a clinical explanation. Remember the word pain. So I'm going to give an example, and this is for everything, whether it's tendonitis of the shoulder to supraspinosus tendonitis, whether it's epicondylitis, lateral epicondylitis, patella tendonitis, neuroma, but we're going to pretend this is plantar fasciitis. Patient, it's acute, okay? You press on the plantar medial insertion, they hurt, okay? You take the laser. Now, when you hold this laser hand, I want you to grab it around the blue. You're going to use this as one motion. You don't want to use the handpiece moving back, right? Move the whole thing back and forth. Again, you press on the plantar medial insertion. You treat from the end of the heel all the way up into the toes. Follow the rays, the first ray, the second ray, the third ray, the fifth ray. Up, back, up, back. After about 3 or 4 minutes, you stop. You repress on the plantar medial insertion. Remember I told you, how do you know the chemical reaction is taking effect? Decreased pain. Fortunately, the Remy is a very high-powered laser. This is all comfortable too. So you're going to get a high analgesic effect. So when you repress on it, again, you don't say to the patient, how do you feel? You press on it and say, does it feel better? If the patient says to you, yeah, it feels better, but you sense that it's not 100%, you got to do it a little bit longer. You got to have the right dosage. So it's dramatic pain reduction. It's typically between 5 and 7 minutes. I like to give analogies. Everybody's had a dead battery in a car. You try to charge the battery, you got to get that right charge to turn over the engine so the car is working. Sometimes it doesn't turn over, you got to charge it longer. Same thing like this, you got to treat it longer. It's between 5 and 7 minutes. Now I'm going to demonstrate on how you use this. You don't use this in clothes, over clothes. I'm going to pull up my sleeve here, roll up my sleeve. You don't go through clothes, remember that. I recommend on all cases 25 watts full power. Now the reason why it's 25 watts full power is because laser energy, deflex, reflex, it's very poor absorbing. So you got to get a lot of power. It's got to be comfortable. Fortunately with a Remy laser, it's a high power, but it's always comfortable. It's a dual wave. It's a 980 and an 810. So you grab this, you turn it on. Always wear your laser goggles. It's not on, obviously. You turn it on and you put it in contact with the skin, and it's up, back, up, back. When the laser's on, it beeps. Beep, 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 beep. That's the cadence. Up, back. You're always in contact with the skin. It's laser massage. Up, back, up, back, up, back. That's important. Now, when do you know you're done? When you press on the, if it's a lateral epicondylitis, we demonstrated plantar fasciitis, you press on it and there's dramatic relief. If they get some relief and it's not 100%, do it a little bit longer. You haven't hit the right dosage. That's extremely important. Palpation, palpation, palpation. I'm going to now go over some of the foot conditions. We did plantar fasciitis. Achilles tendonitis. Hurts right at the insertion. Can be insertional or non-insertional. Laser massage. You start the gastrix, you go up, back. It's always about a foot. Up, back, up, back. When do you know you're done? When you palpate and squeeze it, and there's dramatic improvement. Another condition is neuroma. Okay? You start at the ankle, up to the ankle. You start the tips, you go up, back. You treat the whole top of the foot for 3 minutes, and then you do the bottom of the foot. It's the only time you do the top and the bottom. You follow nerve roots, which I'll explain a little bit later. So when you're following nerve roots, you're doing the tarsal tunnel and follow the medial and lateral plantar nerves into the common digital. You just follow them. Lasers are very sensitive to nerves. So you do the nerves, you do the top of the foot, half and half, 2.5 minutes on the top, 2.5 minutes following the bottom of the foot. You're in contact, and it's the beep, up, back. Never hold the laser in one spot. It's not going to burn them, but it could sting them. Always turn on the laser and then put it on the skin, and when you're done, take it off. Again, never look. I know you know this. I treat everybody like a child, so I just don't want to make sure that you understand. It's never look down the shaft, and always hold the laser down. If you point the beam at the patient, it's not going to hurt them, but then you're going to have to explain to the patient, what's that red beam? The answer, it's an aiming beam. So hold it down, grip it tight. Now, how do you know you're done with neuroma? Palpation, palpation. You squeeze on the area. You squeeze it, okay? And this is real important because there's 2 parts to this. Part 1 is we got rid of the pain. Isn't that great? We didn't have to give you an injection. I always call it Mrs. Jones. Mrs. Jones, we got rid of your pain. Isn't that great? But you can't heal something in one visit. It's like a broken bone. It takes time. I always use the analogy, we just gave you 1 antibiotic pill. We now have to finish the course. Part 1 is get rid of the pain. Part 2 is to get it to heal. It's an average of 6 treatments, twice a week for 3 weeks or once a week for 6 weeks. The key part and why I like to get rid of I call it the wow experience, and I'll finish some of the other treatments that you know, and there's a booklet that we're going to send you that has all this written down and all the treatments. But the key is you want to get them out of pain. You just don't rub the area for 10 minutes. It's palpation. I can't overemphasize this. Palpation, palpation, palpation. And the important thing is that the patient gets to experience the relief. They're more apt to complete the treatment. So that being said, we did Achilles tendonitis, we did neuroma, midfoot arthritis. It's the same thing as neuroma. You do the top of the foot, up, back, up, back. How do you know you're done? You press on the area. You should have palpated and explained to the patient and shown them the original pain. Always show the patient where the pain is and press it. It may hurt them a little bit, but press on it. And then you show them afterwards the results. They're more apt to accept your treatments when they experience the relief. And they didn't have to get a needle. They didn't have to take any inflammatories. Now, I always ask this question. Podiatrists, they see tons of plantar fasciitis, Achilles tendonitis. What percentage do you think we really see of the total population that seeks out medical care? Is it 50%, 40%? Most of my doctors will say 40%. It's less than 9%. And we see tons of it. We're not trying to change your practice or stop you from giving steroid injections. If you ever give us steroid injections, always, if you want to make it comfortable, and I'm not crazy about steroid injections, I can talk to your specific case and your practice with steroid injections. But if you want to give them, it's not contraindicated. But use the laser first because it anesthetizes the area and it's more comfortable. Never do the injection first and then the laser, because you get increased blood supply to the area and it could cause a what we call post-steroid flare-up. Always after, okay? Excuse me, always before, always do it before and not after the injections. Again, the whole goal of laser therapy is not to give a needle. Who wants to go to somebody's practice to get a needle? So if you have any questions, feel free to reach out to me. I'm very happy to answer any questions you may have. Remember, I'm always here to go over any specific clinical case that you have. But in summary, okay, the patient is done when you palpate. Palpation, palpation, palpation. It's used for, again, pain, inflammation, arthritis, lack of mobility. Post-surgical it's used for. When you do, we'll do a whole separate section on post-surgery as well. First of all, lasers and wounds as well. Lasers are amazing post-surgical. I'm talking about right after the surgery, right where this incision has sutures in it. By the way, you can always use lasers over implants, metal screws, pins, unless they have, if sometimes doctors will use staples in the incision. You don't want to use that at all. If you're doing full body and somebody has necklace, you can keep all your jewelry on if you're wearing watches and stuff, but lasers will heat up jewelry and necklaces, so take it all off. Occasionally somebody may have a toe ring, you can't get it off. We'll also talk about tattoos as well. So post-op, you don't want to use Pain 25 full power. It's heat, is my own personal opinion, can affect wound healing. That's why we're going to use pulsing. We call it the sensitive patient. You can use, when we go through the tour of the laser, I'll show you all the presets which are pulsing, and they mix up continuous, which is where the laser is running continuously, or it pulses. I like to give the analogy, continuous is where you take a fire hose and you squirt water full power out. Then you have pulsing, off, on, off, on. So use the pulsing programs. It's called the skeleton. We'll show you pictures of it. All post-surgical. I'll tell you an interesting thing. The best time to do laser is right at the time of the surgery. I can show you studies where they do open fractures, a tibial fracture with internal fixation. And when you do that, it reduces the need for narcotics, less narcotics, better healing incisions. That's why you want to do if you're a podiatrist or any surgery, we do this in all the vets. That's one of the reasons why veterinary medicine, the Remy can be used for veterinary medicine, has a separate program in it. It heals the incision better, because when you have excessive inflammation or swelling, the incision doesn't heal well. You'll get better healing incisions, less chance of infection because it reduces surface bacteria, and the patients have less pain. So you want to, even with the sutures in, you want to start with the laser. It's much more comfortable than physical therapy, setting you up for physical therapy. If you're doing a bunion or where you need range of motion, you can start range of motion right away. You can have them passively move their big toe up and down. If it's a perineal brevis repair, inversion, eversion. Motion is very good with lasers as long as it's comfortable. Have the patient do motion. Very effective. Again, wounds. I can show you a study. Just email me and ask. I was done at the Kent State Podiatry School, which when I was there in 76 to 80, it was called Ohio College of Podiatric Medicine. But all lasers, therapy lasers, heal wounds. They kill the bacteria. They stimulate neovascularization. It's only 1 minute per week. You can do more than one or two a week. You'll get 30 to 50% increased healing of the wound. Of course, you got to use, your standard post-wound therapy. But ask for this, this article. It's an amazing article, amazing article. And it was done at OCPM by Dr. Heatherton. I have a copy of it. It was done for venous ulcers, arterial ulcers, diabetic ulcers. Lasers are also excellent for swelling, lymphatic drainage. It's amazing. We use it for post-mastectomies, post-surgery. So the laser is just not for pain and inflammation, post-surgical wounds. Very, very, and that's what's beauty about the Remy is it's multifunctional. The more you put into this laser and learn about it and let me help you be educated about it, the more effective your patients will do. And that's our goal. Effective treatments always increase revenue. Thank you. I hope this was helpful.